All right, then we start thinking about seating. So we have, as I said a little bit earlier, standard seating and custom seating. And custom seating, as you can see in this picture, really runs the gamut in terms of what we can do and how we can customize a chair. So we want to think in terms of support, and there's lateral support, right? So it's keeping the person in an upright posture. There is trunk support, which may be, as you can see here, it's lateral, but it wraps around. Also head support and abduction at the thighs. So with some conditions like CP, for example, there tends to be an internal rotation and adduction of the lower extremities, and that does not produce a good solid seat when you're in a wheelchair. So we will use the customized seating options to actually help us with getting a more normal lower extremity position, which will help with the definitely with the position in the chair, with balance, with endurance for sitting, etc. Seating options are totally customizable, but as you can imagine, they come at a price. Seat height is another aspect of the whole kind of seat piece of things. And there's a standard height. There's also a low seat or hemi height, so that clients could propel with one upper extremity and one lower extremity, obviously the unaffected side. And we can use cushions to increase the seat height. So that is an easy fix. Typically, there are some cushions in any facility, and we can help customize a wheelchair, by putting in cushions. We also want to account for the height of the cushion when we're measuring for a wheelchair. So if a person is going to be using a seat cushion, we want to take that measurement into account when we're figuring out what size they need. Back height is another consideration. There is a standard height. There's also reclining chairs. So for some folks, they need to have that option either to relieve pressure, or they might have orthostatic hypotension, so they need to be able to be laid back, etc. There's also adjustable height chairs. There's super low height chairs, as you saw with some of those ultralight wheelchairs, so they don't need the back. So we're going to get rid of it both for weight considerations and also so that you don't have that back interfering with your push. And we can customize the back height of a wheelchair. And notice on this chair, there are push bars for a caregiver to push the wheelchair. Okay, so back to this idea of dump. So seat factors include dump and rake, and they basically mean the same thing. You'll hear both those terms. It refers to the angle of the seat compared to the ground. The back of the seat is lowered, so the front goes up, right? So we have an angle. As I said, if someone has poor trunk control, it can feel more stable and there's more efficient push. But there's some potential problems with dump, and they include things like more pressure on the buttocks and the back of the thighs, and being in this acute angle is not always the best position to be in. So it's a trade-off. And here is the slide that spells out the issues with dump. Of course, I didn't I didn't advance the slides, but here you go. Okay, so your knees are raised, your spine is rounded because the knees are up, right? So you're compensating for keeping your center of balance. It can lead to back pain and deformities because that. Hip angle is closed, so circulation problems. And then, as I said, it adds pressure and something called shear forces at the sacrum. So shear forces are, whoops, and I've missed one tiny, there. Okay, so shear forces, what that means is when there is pressure in two different directions, it can produce abrasion, right? So we have the sacrum coming down and then the seat pushing back. And so that can increase the risk of skin breakdown because there's extra added pressure beyond what a person would experience if they were sitting perpendicularly, right? So sacrum here, wheelchair seat here, there's downward pressure, but when we add dump or rake, there's downward pressure and inward pressure. Hopefully that makes sense. Let me know if you have questions. I'll be happy to demo and also to talk about it more. All right, so cushions and supports. We have a couple different varieties. We have custom and also off the shelf. And notice in this photo, I like it because they're adding lateral supports as well. And that would be very handy for anyone who has difficulty with trunk control, strength, or endurance. Then we have armrests. Notice that on the left chair, the armrests run the full length of the seat of the wheelchair, and on the right photo in the blue, the armrests are a little littler and shorter, and they're back further. So we can customize that. We can also customize the amount of padding that's on an armrest, and different configurations are going to serve different clients. Here's an example of a padded armrest. Really padded, right? So this may be for someone that has had a CVA and has a left-sided impairment, right? It's a nice, big, cushy, supportive area for that affected upper extremity to rest. All right, other options with armrests. Detachable, so pull it off, swing it away. Don't pull it off, it just is there, or a custom. So which armrest would make transfers easier? Hopefully you are thinking about the fact that, you know, if you're transferring maybe with a sliding board, that you're not going to be able to do that if you have an armrest. If you are standing for the transfer, it may be that the armrest is really handy for you, right? So it depends on what sort of transfer and what you're up to. So again, if you have questions or you need to see a visual of that, let me know and we'll go over it in class. So we have armrests and we also have leg rests and foot rests. The leg rests are extending from the seat of the chair, and the foot rests are at the bottom. Notice that the leg rests on the left are padded, and on the right they're also padded, but they're a little bit concave to fit the calf. And foot rests and leg rests come again in a variety of sizes, shapes. They can swing away, they can lift off, they can do a lot of different things. Some of them actually extend out so you can change the angle of the footrests, or the leg rests, excuse me. And the footrests typically swing up as well so that you can leave them in place, but they're out of the way if you're transferring. Okay, so now we move on to wheels. And there are front wheels and back wheels on a wheelchair. We call the back wheels, and we call the front wheels casters, and the front wheels are smaller. So the standard size for a wheelchair, and obviously, sorry, I keep saying obviously, I don't know why. We use this 24 inch as a standard size, but there's a lot of different diameters of wheelchair wheel depending on the person. There are 3 different materials we make them out of: hard rubber, or 3 different types, semi-pneumatic and pneumatic. So pneumatic wheels are under pressure. The benefit of them is that they make for a smoother ride, right? So anytime we're going over compressed air, we have a much smoother ride. It's less bumpy, there's less impact, but they take more maintenance. So if you're a wheelchair user and you get a flat, that's really a drag, right? Semi-pneumatic are preferred by a lot of wheelchair athletes because there's some measure of shock absorption, but they're a little bit more durable than the pneumatic. And then we have hard rubber, which is just like it sounds, hard rubber. So more bumpiness to the ride, but much less maintenance. Casters, same set of different kinds of materials that they can be made of. And they're smaller than the back wheels. So large rear wheel, small front wheel. Then we have rims, and rims come standard, which is with a smooth ring outside of the actual wheel. They also come with knobs, so somebody can push on the knobs rather than the actual wheel rim. And they have different textures. Some are like foam-like, and there's some that are dual drive. So that would be for the person who's had a CVA and needs to operate the wheelchair with just one upper extremity. We link the wheels together so that you can steer using one rim. So a lot of different options depending on the upper body skill of the person, their strength, what they want to do in their chair. So again, there's so many options that will determine what sort of rims are best for that particular client. The next thing I want to talk about is something called push. And push is how much power you get when you put your hands on the rims and propel yourself forward. The most ergonomic placement of for rear wheels for push is in line with the hips, with the individual in the chair, and then you push starting from slightly behind your hips and moving forward. And we have. Where did I put that video? We'll look at a video of push to see what is the most powerful and also ergonomic and safe way to push. And it appears to be that there's an oval that's right around here. And so you push down and then you bring your hands back up. And one thing that we want to consider with folks who are in wheelchairs and using that as their prime form of mobility is the shoulder integrity and not getting repetitive stress or other injuries due to pushing a wheelchair day in and day out. Notice that this person has a slightly rounded back and hip angle, and we want to, again, balance that. And he's also doing a wheelie right now. We want to balance that out, the considerations of force and pressure on the sacrum with the increase in ability to push. And so if somebody has upper body mobility and can do weight shifts, that's going to make it a lot easier and more effective to have a little bit more dump or rake. I think I just did rims. Didn't I just do rims? Yes, I did. Sorry, I'm going backwards. All right, so now we're going to look at a few different types of manual wheelchairs. So we looked at standard, light, and ultralight, and now we're going to look at some other options. So here we are again, standard manual wheelchair. But then we can have a reclining wheelchair, as I said a little bit earlier, where the back goes back and the leg rests elevate, so we can get a lot more positioning. It opens up the hip angle. If the client is not able to sit upright, it can enable them to be in a wheelchair without needing to sit up. All right. and notice that the back is extended. So if the person doesn't have good head control, we can accommodate for that. On the back as well, you can see one of the push bars back there, and notice that it has a brake on it. So that's another feature. There's also bariatric wheelchairs, and those are for very large patients. They start at 20 inches wide. So some folks are going to need a much wider wheelchair depending on their height and weight. This is a manual wheelchair with tilt in space. So the recliner just has the back that goes back. This one, the entire chair, you can see that there's sort of a rocker, right? So the entire chair seating system tilts in space. So it's yet another option. The wheels are smaller on it, and it is specialized for someone who cannot operate a wheelchair at all. The seat angle doesn't change when it's tilted back. The whole apparatus tilts at once, and pressure is redistributed, for example, from the thighs and buttocks to the back. So it's a nice option for folks that don't have a lot of mobility. And it offers better pressure relief than reclining chairs because you need at least 45 degrees of tilt to get that pressure off of the thighs and buttocks. This is a transport wheelchair. It is for clients who can't self-propel themselves. It's used in hospitals and airports. You might have seen it, somebody pushing when we used to go to airports, someone pushing a wheelchair through the airport. It's less expensive, doesn't give much support, not really customizable, and we don't usually order them, but we want to be familiar with them and that they exist. And notice also that there's a seat belt. So seat belts in chairs are another option. This is an all-terrain wheelchair. So now we're getting into the super awesome stuff. Notice it has big, fat, knobbly tires. It has a fifth wheel in the back to prevent it from tipping over. It's got handbrakes, and they're very far forward. So think about going up a hill, right, and leaning forward, or coming down a hill and leaning back. And two little tiny wheels in front. It's also got a drive chain, much like a bicycle, and this very cushy back, but it's a low back. So that's another whole area of wheelchair use. And then this is a beach or water wheelchair. It's got ginormous tires front and back, and notice that the big tires are in the front and the small ones are in the back. It's got a anti-tip device in the front, so there's two little tiny casters in the front in case the wheelchair goes forward. It's not going to dump out the person, and it is pushed by someone else. Now there's also beach or water wheelchairs that are more like tanks, right? So they have that belt that goes all the way around, and so that's another option. It's extremely expensive, but it definitely is another option. At some point, I'd love for you to quiz yourself to name all the parts of the wheelchair, and you have all of those parts on diagrams in with the resources for this unit. So do know all the parts of the wheelchair and the names of the different parts and what they're used for, and the details about them. Okay, now we're going to go into powered options, let's see. For clients that need powered wheelchairs, there are progressive diseases. As I said earlier, some examples are ALS or amyotrophic lateral sclerosis, muscular dystrophy, etc. Folks with decreased endurance use powered chairs. Also, those with high-level spinal cord injury, so C5 or above. There's not enough upper extremity use to push a wheelchair, a manual wheelchair, and also those with significant physical limitations like clients with cerebral palsy. There's actually two different options, so I called it powered wheelchairs, but there are scooters, as you can see on the left, and chairs that you can see on the right. A little anecdote and also note about our language. We typically use powered options rather than electric options because we don't want to be talking about electric chairs. We give powered wheelchairs to very young children, and that is purely to increase their mobility. And because they're young and developing, parents will have a remote, or it's also called a kill switch. So it's like a parental control, so you can stop the wheelchair so that kids don't go crashing into stuff. But it's not really a great idea to talk about a kill switch on an electric chair. So we use powered chair because it sounds a lot better. So first, let's talk about scooters. Scooters are often seen as more "quote unquote" acceptable. It's like a little device that you drive around rather than a wheelchair. They are inexpensive, which is a benefit. They have a swivel seat, so you can pull up to a table and then turn yourself rather than trying to fit the wheelchair or the device under a table. And they typically have 3 or 4 wheels. There's limited seating options. They can be difficult to use inside, and they are in the range of $600 to about $1,000. The long wheelbase makes tight turns difficult. That's why it's hard to use them inside. They're good for individuals with low endurance, particularly out in the community. Like one example is folks with multiple sclerosis, or MS. They need a specialized lift on the back to put it into a van. So the mobility options for the device need to be worked out, and you need to have fairly good upper extremity function and strength to operate them. Next up is a power wheelchair, and there are a lot of different options. There's seating and positioning options. There's options for steering and how you actually operate the chair. They are adjustable over time. So remember, way back at the beginning of the lecture, I said it would be important to look at prognosis and decline in function. So making these adjustable is a really powerful tool that we have. And they are expensive. There's a variety of different options which we'll be discussing. They run, however, and this is a big range because of these adjustability options and different features, between $10,000 and $30,000. So a significant jump from our manual chairs. The first option is the drive option, so what powers the chair. Front wheel drive handles corners really well and gets into position very easily. Rear wheel drive goes faster and straighter. And mid wheel drive has a tight turning radius, but it can be a little bit squirrely with abrupt changes. So depending on the client and what they need will depend on what sort of drive option you choose. Clients need to practice with a demo power chair to decide on which would be best for them. So, because it's such a big investment and because there's so many different needs for folks in wheelchairs, we want to be sure that this is the perfect match. So here is a power wheelchair with tilt in space. So we looked at one that was a manual tilt in space. This is a power tilt in space. It adds cost to the wheelchair, but it also enables it to be much more customizable and to better fit the need of the individual. Now, remember, if someone's using a powered chair, chances are, not always, but chances are they have less mobility. So this option of the whole chair shifting in space or tilting in space could be great because rather than the person needing to leave the chair to get pressure relief or a change in position, we can simply tip the chair or tilt the chair. most power chairs with tilt and space cannot be driven when you're fully tilted. That's a safety feature. You don't want to be flat on your back and going forward. And the override feature locks out this drive capability. So it clicks into fully tilted and out of drive. There's also a lot of different ways to control a power wheelchair, and I have linked 3 different videos that give you examples of how many different types of really innovative ways there are to drive power wheelchairs. There are facial switches where you push against something to make your wheelchair go. Head switches where you'll use your head. Chin, breath, so that is sometimes called a sip and puff to get the chair to go and stop. You can operate a chair with your tongue, or what we more commonly see, the chair can be operated with a joystick, which is mounted on the chair. And here's a joystick. You can see it on the back of the photo on the right side. There's a little protrusion, and that's a joystick. And of course, all different kinds of joysticks. So check out those videos. They're super fascinating. All right, so we've reached the end of this video. Up next is wheelchair measurement. So I've linked a wheelchair measurement video for you. And I want you to start thinking about like, why does a wheelchair need to fit properly? And how what might be the different aspects of wheelchair fitting that we want to look at to make sure that that chair fits. This is a photo of Team USA at the Paralympic gold medal competition from 2012. So it's a little bit old, but it's a super cool photo. Note that there's a ton of camber on these chairs. They have very low backs, and they are athlete chairs. All right, everyone. Thanks for tuning in and watching and listening. And we will return with our wheelchair fitting video. And I will jot down your questions. I'll see you in class, and we can go through a lot of this information and clarify anything that was not clear. Thanks so much. Bye-bye.